Hi, I'm Dr. Ed Beyer. Welcome to our video on identifying and removing the 22 patterns of thyroid dysfunction with functional medicine. I'm a chiropractic physician that practices functional medicine, which you're going to learn what that's all about. I've been in practice for 32 years in a southwest suburb of Chicago called Tinley Park. We have patients all over the country, and so at the end of this video, I'm going to be offering you an opportunity to consult with me either virtually or in my practice if you live nearby. So my advice to you is to watch this all the way through. The big picture, this video is for people who are just really sick and tired of being sick and tired. They think they have a thyroid problem or they know they have a thyroid problem and they're going to their doctor and they're looking at TSH and T4 and they're just not feeling better. So you're going to learn a lot in this video. You're going to learn the 22 ways. I'll try not to make it too boring, but the thing that I really want you to take away from this is there's so many ways the thyroid can go wrong that your endocrinologist or your medical doctor is not looking at. So the common questions that we see from patients that come to our clinic or that we discuss with, either with Skype or on the phone is, how can I know for sure I have a thyroid problem? Because a lot of you are suffering from fatigue and hair loss and weight gain and all these different symptoms, and you think you have a thyroid problem, or you're going to your doctor and they say that your levels are normal, but you have all these symptoms that sound like a thyroid problem. So we're going to get into that and we're going to discuss exactly how you can know for sure. And why does my MD say that my labs are normal, but I don't feel normal? Oh, we're going to really teach you on why that is, and it's going to be very enlightening to you. Is my MD missing something? If so, what? Let me just be really frank with you. 32 years of managing and supporting people with thyroid issues, the medical approach to treating thyroid is woefully inept. And you're going to learn that, and it's going to become very apparent to you if you watch the entire video. How can functional medicine identify and correct whatever thyroid problem I have? Well, we're going to be discussing that. And what specific lab tests do I need to finally have to figure out my health? A lot of you, and I know, are out there, you're online, you're looking into thyroid. Should I take iodine? Do I have a goiter? Should I go gluten-free? And what you're basically doing is you're guessing. The key is to do the proper testing to figure out what you don't have and what you do have, because everybody with a thyroid issue or with a chronic condition is different. The key is in the testing, which you're going to learn today. So the prevalence of thyroid is huge. The American Association of Clinical Endocrinologists say that 27 million Americans suffer from a thyroid condition, and 50% go undiagnosed, or it takes a while for them to diagnose it. Over 70% of thyroid dysfunction is due to an autoimmune disorder where your immune system is attacking the gland, known as Hashimoto's thyroiditis, and 90% of hypothyroid patients are female. So if you do the math on that, that's 1 out of 8 females suffers from a thyroid condition. And there you go. So traditional medicine's management of hypothyroidism, they just look at one of the 22 ways, the patterns that you're going to learn today. They look at TSH, which is actually not even a thyroid hormone. It's a hormone that comes from the pituitary gland, the brain, and drives the gland to make T4 and a little bit of T3. So they're looking at that feedback loop. But as you're going to learn, if you watch this entire video, you're going to learn that there's so many ways, different ways that it can go wrong, and they're missing a lot. So if you are suffering, this is a video of hope. And they manage the symptoms with pharmaceutical. Did you know that Synthroid, or the generic form of Synthroid, levothyroxine, is the #1 prescribed medication in the United States because it's such a big problem, thyroid issues. And the symptoms of thyroid dysfunction are far-reaching. Every cell in your body needs thyroid hormone to function. We're going to get into that too. Now, a little disclaimer here, don't expect your medical doctor to understand or even accept what you're going to be learning in this seminar today, in this video, because they've been taught this stuff, but they're viewing it from a very pharmaceutical perspective. Today, we're going to get into the actual physiology of thyroid so you have a better understanding. I promise I'll do it in a way that you'll understand, and we're going to get into all the different areas that it can go wrong. So the functional medicine, what we do, basically, we do care about what you have, but we're more interested in why you have it. So we get into the why and we address that and we correct it so that you can actually get over this disorder. Whereas traditional medicine doesn't care about the why. They're just looking at your TSH. If it's high, they're going to put you on levothyroxine or Synthroid or maybe some other type of hormone. So their approach is pharmaceutically based. And I just want to spend a few minutes really educating you on the difference in perspective between traditional medicine and functional medicine. You know, our healthcare system is a very pharmaceutically driven system. The United States represents 5% of the world's population, and we consume 72% of the world's pharmaceuticals. Now, don't misunderstand me. I'm not against pharmaceuticals. We work with MDs, and sometimes we co-manage cases with MDs, but I have a problem with that. You know, the United States is 48th in the world in longevity and morbidity, yet we spend more money per person on healthcare than any other nation by far. So I'm going to share with you something. It's a message. Please don't get mad at the messenger, okay? If you want quality healthcare for a chronic condition, don't expect your pharmaceutically driven healthcare system to pay for it, because Big Pharma is also in charge. They've decided, and they've worked with insurance companies on what to cover and what not to cover. So that's just the way that it is. And I go over cost of my fees that we do at the very end of the clinic, at the end of the video. So you need to understand, folks, our health there's no price you could put on our health. So we spend money on a lot of different things: cell phones, trips, clothes, and expensive automobiles, home repairs. We live in this thing 24 hours a day, 7 days a week, the amazing human body. So, and I know a lot of you are suffering out there, so just sit back and really, you might even want to take some notes and learn about the things that your doctor is missing. So if you don't believe me, check out this quote right here, this paragraph right out of the Medicare guidelines. A treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or a therapy that is performed to maintain or prevent deterioration of a chronic condition is deemed not medically necessary. See, and Medicare is the template of all other insurances. See, our healthcare system, folks, is really, really good at acute illness. If you have an infection, a heart attack, break a bone, do it in the United States, because our healthcare system for emergency care is phenomenal, and our healthcare system is really good at keeping us alive on medications. But they really don't have much to offer when it comes to chronic illness. You can't medicate your way out of a chronic illness. When I do these seminars live, I always ask the audience, name 2 changes you can make in your life right now that would make you healthier. And what I never hear is this: I think I need to take more medication. Okay? So we're going to be addressing all these underlying causes. So the beauty of functional medicine is that it can be done virtually. So I have patients all over the country, one in Virginia right now, Las Vegas, because this is just a transfer of information. For example, we use LabCorp as our lab, and they're all over the country. The labs and kits, the specialty tests that we do that you're going to learn about in this video, we can send to patients around the country, FedEx it, and they can collect the sample at home and send it to the lab, and we get the results. The consultations that we do, lifestyle changes and exercises, that can all be done via Skype or telephone, and we always have unlimited email access when we're working with patients. The nutraceuticals or supplements that we use, we drop ship and you get them to your home in a day or 2. So this all can be done very easily in a virtual manner. Now, I also have other 1-hour videos available on my website, Beyer Natural Health Solutions, because a lot of you that will be watching this, you may have some other issues going on. We have an autoimmune condition, thyroid, digestive. We have a whole life metabolic, wellness and weight loss, female hormone imbalances, really good video. And we have one on chronic pain and fatigue, like fibromyalgia, seasonal allergies, Crohn's disease, and ulcerative colitis. We have one on Hashimoto's, specifically for thyroid, people that have bad thyroids, but it's Hashimoto's, migraine and chronic headaches, chronic neck and back pain. So be welcome to watch any of these videos, and they're very informative, like I hope you find this one to be. So here's how the thyroid physiology, and I need to explain this a little bit, so hopefully this won't sound too technical, but it all starts in the brain. So we have this area in our brain that's kind of like the air traffic control tower of all of our hormones, not just thyroid. And it's called the hypothalamus and the pituitary gland. So this is the area of the brain that detects when our hormones are dropping. And in the case of thyroid, it's T4. So we know in thyroid, there's two different hormones. There's T4, because that has 4 atoms of iodine attached to it. And then there's T3, has 3 atoms of iodine. So when T4 drops, that's the one that the brain looks at, the pituitary gland is going to send out a little signal hormone called TSH, thyroid stimulating hormone. And that's one of the main markers that your doctor looks at. Ironically, it's not even a thyroid hormone, it's a brain hormone. So what happens is TSH then will tell an enzyme in your thyroid called TPO to make T4 and a little bit of T3. So what comes out of the gland is mostly like 93% of it's T4, but ironically, T4 is actually inactive, and about 7% of it is T3. Now what happens is these hormones just don't float around willy-nilly. They jump onto a protein called thyroid binding globulin, and that protein is like a taxi cab. It delivers mostly T4, 93%, and a little bit of T3. T3 will deliver to the tissues, but T4 is going to deliver it mainly to the liver, the gut, and the kidneys, and there T4 inactive thyroid gets converted to T3 active thyroid. That's very important because a lot of you are not doing that, and your doctor's not even looking at T3. They just assume that that conversion takes place, and you're going to learn today that there's 5 different ways that can stop that from happening. So T3 is the active form. T3 then goes into the cell, and by the way, there's some things that'll prevent T3 from getting into the cell, and we'll discuss those. T3 goes into the cell, and what it does is it goes into your DNA, to your genes in the nucleus of the cell, and it turns genes on and off all day long to run your metabolism. So, because that cell is going to die someday, right? So that cell needs to make new genetic material, new proteins and things to create a new cell. Or that cell is alive and it needs enzymes and structural proteins to be made. So that's what it does. It really runs the machinery in our body. Every cell in the body requires proper thyroid hormone function. No other hormone can make that claim, especially the brain and digestive system. That's why so many of you, when your thyroid's not functioning, a lot of digestive problems. You can't produce stomach acid, digestive enzymes, constipation's a really big problem. And then we see a lot of neurological symptoms like brain fog and memory loss and anxiety and depression and all these, you can't focus, you can't concentrate, you need extra sleep. So we're going to talk about that too. So the symptoms of thyroid dysfunction, the number one that we see is fatigue, weight gain. Those are actually, I've been doing this 32 years. Of all the chronic problems that I see besides thyroid, those are the top 2 complaints that I hear is I'm gaining weight and I don't have energy. Number 3 is brain fog, depression, lack of motivation. Those are neurological. And bloating, acid reflux, poor digestion, constipation. Folks, if your gut isn't working, you're not going to be healthy. That's just the bottom line. Dry, brittle hair loss. And the areas, see what thyroid does, as we already mentioned, it stimulates the genes to make new cells. So the areas of the body where there's a high, quick cellular turnover, like the gut, your skin, and your hair and nails, those areas suffer the most because they can't keep up. They can't replace the dead and dying cells. We see a lot of skin issues, weak nails, poor circulation to the hands and feet, cold hands, cold feet, all that. It's ubiquitous. Sensitive to cold weather. You require extra sleep to function. You heal slow. You catch colds and flus because your immunity's down, morning headaches, and low libido. So the thyroid supports everything, as I already said, but just to be a little bit more specific, sex hormones, your other hormones, in females, estrogen, progesterone, in males, testosterone and estrogen. Although rarely, I don't see too many male thyroid patients, although I remember my first one was male. It's about 10%. Fat burning. You cannot burn fat without your thyroid hormone working. It just isn't going to happen. And people come to me so frustrated, like, my doctor says to eat less calories and exercise, and I'm doing that even though I'm so fatigued all the time, and I'm still not losing weight. When we get our patients, when we figure them out, and we go through, we check all these different 22 ways, and most patients have like 3 or 4, and we correct them, their weight just comes off them like butter on a hot skittle. All right, so high cholesterol levels, because thyroid has to do with fat metabolism. Liver and gallbladder function is dependent on thyroid function. So many of you don't have a gallbladder anymore, and this is the reason why. Poor stomach acidity. Folks, when we don't produce enough stomach acids, see, a lot of you are probably thinking, well, I have too much acid, I have heartburn. That's not true, okay? When you have too little acid, your food sits there longer and you get bloated, and the acid you do have just pushed up. It's a pressure problem. And you got too much here because you got too little down here. And the irony is your doctor then puts you on proton pump inhibitors, Nexium and Prilosec and omeprazole, and that just further makes the problem worse. It changes the pH of your gut, your microbiome changes, you won't absorb your nutrients, and you get this cascade of problems. So many of you are on these acid reducer medications, and I hope you're aware that even the manufacturer of those antacids medications say you're only supposed to take that 14 days every 3 months because it shuts down your absorption, and so many of you are just taking it day in and day out. We get people off of those medications usually within 4 to 6 weeks without symptoms because we correct the underlying problem. So poor gut function, immune system, brain and nervous system, and bone metabolism. Thyroid hormone is the body's major metabolic hormone. It keeps each cell's metabolic processing going by turning genes on and off. It knows how to do that. That's T3, not T4. So here's what I hear all the time. People come in, my doctor says my labs are normal, and I don't feel normal. What's going on? I'm so frustrated. Well, I'm going to teach you something. Lab ranges are based on this. They're based on the average person who has been to that lab for the last year. Now, think about this. What type of people go to labs? Sick or healthy? It's mostly unhealthy. So those lab ranges are based on an unhealthy population. Your doctor is waiting for you to get sicker than the average American before they say you have a problem. So we don't use lab ranges. Lab ranges are based on sick people. We use what's called functional ranges. I'm going to go to the next slide. So right here, for example, TSH. Now, most labs are going to say, if you look in the middle column there, 0.3 to 5.7 is the normal range for TSH. Well, the normal range based on whom? Based on people that go to labs, unhealthy people. The American Academy of Chemists and the Endocrine Society said that is really an inaccurate way or not a very prudent way to be compared. So what they came up with functional ranges, which are tighter for the most part. Sometimes they're wider, but mostly they're tighter. And these are the ranges that if you drew the blood of 1,000 healthy people, they would fall in those ranges. Those are the ranges that I compare you to. So look at TSH, 1.8 to 3.0 is a healthy person's range. So look at the results. If you're at 4.2, your doctor's gonna say you're fine because you fall within the lab range. We're gonna say you have a problem. So that's why early detection on any type of chronic disorder is key. You have to use functional ranges, not lab ranges. Now, I know that makes some of you upset, but it should actually be eye-opening to you because we're able to sleuth out so many problems using functional ranges. So, and then again, they don't run enough markers, right? There's no way that they're running the markers to detect the 22 different patterns, right? So typically they look at TSH, right? That's the gold standard. Sometimes they look at T4. So they believe, and I really want you to pay attention to this because it's gonna really be eye-opening to you. They believe that if TSH is too high, that your thyroid's too low. And that's true, but it's only true in 4 of the 22 patterns. So, and that's why they're adjusting your levothyroxine, your Synthroid, and you're going crazy, and you're not getting, the symptom relief that you want. We run 9 to 10 markers. TSH is a very important marker, but in and of itself, it only looks at 4 of the 22. We run free T4, which means the part of the hormone that's not bound to a protein. Total T4 is free and the part that's bound to a protein. And same thing with T3. We look at both of those. Reverse T3 occurs where T3 gets converted into a form that's not usable. That's called reverse T3. That happens when the body's in a bad, like inflamed state. And you cannot use reverse T3. T3 uptake has to do with how well you're able to get T3 into the cells. See, hormones floating around in your blood, they don't do you any good. They got to get into the cell. where they can work on the genes and the DNA. So there's a lot of conditions that cause a decrease in T3 uptake. We're going to be covering those, and your doctor never looks at them. And even when I discuss this, and I've given this seminar like so many times, but it's so frustrating and it's so easy to fix. Then we look at the antibodies. TPO. TPO is thyroid peroxidase. It's an enzyme in the gland. TGB, thyroid globulin, is the backbone protein of T4 and T3. And TSI is the receptor site where TSH attaches to. TPO and TGB are the antibodies we check to rule out or rule in Hashimoto's. Hashimoto was a Japanese guy in 1912 that discovered this autoimmune process. So it's an autoimmune condition. And TSI antibodies are what are positive in Graves' disease, hyperthyroid. Other hormone markers that impact thyroid function. So we got to look at these other hormones because they have an influence on thyroid function. Cortisol, as you're going to learn, is a major, major hormone that if it's too high or too low, that will impact thyroid function. Progesterone, estrogen, testosterone, insulin. We look at A1C, which is a blood sugar marker. It's a glycosylated end product that will affect thyroid. Glucose, your levels of blood sugar. We look at the liver enzymes because that greatly impacts thyroid function. Vitamin D does. Homocysteine, which is a type of amino acid that we make in the body that decreases the ability to get T3 into the cells. Your gut flora. Remember, the active form is T3. It's not T4. But what comes out of the gland is mostly 93% T4. It's got to go from T4 to T3, and a lot of that occurs in the liver and the gut. So if you're with the microbial action of the gut flora. So if your microbiome and your gut flora is off, then you're not doing that. And then we got to fix the gut flora, see? C-reactive protein is an inflammatory marker, and there's just a ton of other markers that impact thyroid function. You got to remember that we don't care what you have, we want to know why you have it, so we got to get to the underlying problems. So the first 5 patterns actually originate in the brain, in that air traffic control tower that we talked about, the pituitary and hypothalamus. So we're looking, if we go back to our little schematic here, we're right in this area right here. So 5 causes, there are 5 things that we know will shut down the ability of that area of the brain to work properly. And by the way, that's going to cause a lot of other symptoms too, not just thyroid. Serotonin deficiency, right? So dopamine deficiency, elevated cytokines. Now, cytokines are chemical messengers in the immune system. So if you're systemically or whole body inflamed, you got increased cytokines, and we can look at that through a marker called C-reactive protein and others, then that area of the brain is loaded with receptor sites for inflammatory chemicals called cytokines. When you're inflamed, whatever the reason is, that area of the brain doesn't work well. And not only will your thyroid function decrease, but so will your other hormones. Elevated prolactin, to be honest, we don't see that too much. These are usually due to benign pituitary tumors. In fact, when we do see it, then we send you out to a neurologist. And elevated cortisol, which is an adrenal stress hormone. All of this leads to functionally low TSH. There's less stimulation of the thyroid, right? Thyroid stimulating hormone. To your doctor, they're only in that one model. They think that low TSH means your thyroid's too high. So, or excuse me, low TSH, yeah, thyroid's too high. I said that right. So it's an inverse relationship. High TSH, low thyroid, low TSH, high thyroid. So if your doctor sees this, they're going to assume, oh, his TSH is low. That means that the thyroid's got to be high. And it's low because the problem's in the brain due to one of these 5 things. So the common causes of low serotonin and dopamine and high inflammation, all these 5 reasons, poor blood sugar. If your blood sugar is swinging up and down all day long, that area of the brain is not going to function well. Poor gut function. Genetic mutations, which we're going to talk about later on, MTHFR, a lot of people know about that. Certain medications, especially the ones that you take for depression, which so many of you are on, the selective serotonin reuptake inhibitors can cause that area of the brain to shut down. And then less TSH and less stimulation of the thyroid. So things like Celexa, Lexapro, Prozac, Zoloft. And then the selective dopamine reuptake inhibitors like Wellbutrin can do that also. An inflammatory diet, food sensitivities, hidden infections, autoimmune disease, other autoimmune diseases, leaky gut syndrome, post-pregnancy, poor progesterone estrogen ratios in females, and prolactinomas, which I said we very rarely see. Now, you can see, folks, here's what I want you to be thinking. Well, my doctor doesn't check for those things, right? Well, that's the problem. That's why you're still suffering. We do. The key is in the details, in the testing, to figure out what you have. So common causes of low serotonin and dopamine. By the way, if you have low serotonin, you are going to be depressed. You're going to have brain fog. You're going to have low dopamine is all about motivation and reward and pleasure. Low dopamine, you're going to have symptoms like you just don't enjoy life. Things that you used to enjoy aren't enjoyable anymore. You're not going to want to be social. Those are some of the symptoms. So the common causes of these are adrenal dysfunction, which causes high cortisol and sometimes low cortisol, anemias, which we see a lot of. Your red blood cells are constant, billions of them are dying every day, and we got to make new ones. If you got like stomach issues or you're not absorbing, you're not able to absorb your iron or B9, B12. So we see a lot of anemias on our patients. Poor sleep can do it. Junk food, sugar, alcohol, caffeine, nicotine, and there's many others. Proper testing is the key, folks. It really is. So many of you are just, and I don't blame you because your doctor's not giving you answers, but you're going online and you're like, I got a thyroid condition and Susie did this and Jane did this and this book says to do this. You're guessing. And you could spend 2 lifetimes guessing. That's what we do in our program is we do the specific testing to rule out what you have. And so here we see, for example, someone with low TSH and low thyroid. And that's perplexing to your doctor because they usually see the opposite. But this would be the pattern we would see on the blood work when that area of the brain isn't working well. And here we see someone with high cortisol. Now, this is an actual saliva test that we do, and we measure cortisol levels. The blue line is the patient. That green shaded area is where you should be. You could see where, and we collect the sample 4 different times during the day because cortisol has a rhythm to it, high in the morning and decreases throughout the day. And you can see this particular patient had high cortisol in the morning, and that's going to shut down the pituitary gland, less TSH, less thyroid stimulation. So then in that case, we got to get, why is her cortisol high? And we have to address that. These are some inflammatory markers that we see in the blood work, C-reactive protein and homocysteine. So this patient has high inflammation, which means high cytokines, which means pituitary gland slows down, less TSH, less thyroid stimulation. And here we see certain mutations. We always do a genetic test on most of our patients, a cheek swab, looking at different common poor genes that relate to chronic illness. This person isn't able to convert folic acid into methylfolate, the active form, due to certain mutations, and you need methylfolate to make serotonin and dopamine, right? So in this case, we would just circumvent that mutation by giving them methylfolate or methylcobalamin directly instead of the inactive form of B9, B12. So causes to thyroid disorder, so that's 5. 1 through 5 is dealing with the brain and the pituitary gland, mainly in the hypothalamus, shutting down due to those reasons. 6 and 7 is the most common, folks. And a lot of you have it and don't know it, but it's an autoimmune disease. Your immune system is mistakenly forming antibodies. It's attacking the enzyme or the protein or both, or in the case of Graves' disease, the receptor site for TSH in the thyroid gland. So there's antibodies to TPO and TGB. That's called Hashimoto's. It's autoimmune thyroid. And in the functional medicine world, we're going to really address, well, what's causing your immune system to do that? So we're right in this area right here where that circle's at. And here we see, now this person's going to have high antibodies. You can look at the bottom of the chart here. TPO antibodies and TGB antibodies are elevated. So this person, boom, right away, they have they don't really have a thyroid problem directly. They have an autoimmune disease attacking their thyroid, right? So yeah, the thyroid's not functioning because the immune system's attacking it. And now the gland cannot function very well. And so the brain is sending out more TSH to try to get it to go. And the thyroid gland is like, someone keeps throwing bombs on our machinery and we can't make the hormone. So you see the hormone levels are low. Positive antibodies, really, really important. The reason why your doctor doesn't check for that is because they don't have any answers to it. What are they going to do? Okay, you're autoimmune. Well, we still got to give you Synthroid and levothyroxine. So I'm not going to make this into a video on Hashimoto's or autoimmune thyroid, but I have a whole separate one where we talk about the 15 triggers to Hashimoto's disease. If you know you have that, the hallmark of Hashimoto's is you just have these ups and downs, flare-ups and remissions, and flare-ups and remissions, and your TSH can fluctuate wildly. So I would suggest that you go to my website, Beyer Natural Health Solutions, and watch that video. So here we see one of the causes is leaky gut to autoimmunity in general, and especially Hashimoto's. That's where the gut membrane is too permeable. You got these microscopic holes. It's like having holes in your screen door on a hot summer day, and things are making their way into your bloodstream that don't belong. Microbes and larger than normal food particles, and your immune system's going crazy, and that's going to make your immune system make mistakes, and one of the mistakes they make is they start to attack your own tissue. And so here, this is a test that we do for leaky gut, and the yellow and red shows what type of leaky gut. Folks, leaky gut is, it can be tested for. There's 3 different types, and it can be corrected pretty quickly. And boy, that's the gateway to autoimmunity. So again, it's like having holes in your screen door on a hot summer day, and you live next to the woods, and you got these bugs making it in your home, and you're the immune system going around trying to kill all these bugs, and you're knocking over the lamp and the table, and you bruise your knee and you fall. Okay, just fix the screen door. So one of the things we have to do for the immune system is we have to take a load off the immune system. We have to fix that barrier system. It's a test that we do on everybody, and it's crucial it's the first thing we correct in anyone with chronic disease, especially autoimmunity. So here we see another cause of Hashimoto's or autoimmunity is high blood sugar. Because when you have high blood sugar, you have insulin surges, and that drives the immune system crazy. And food sensitivities. There are so many people out there walking around with food sensitivities. And folks, there's a lot of really bad food sensitivity testing. You got to make sure that whatever test you get done, they're looking at both antibodies, IgG and IgA, because those are the antibodies that exist in the gut. So this is an example of what we do. It's a finger prick test that you can do right in your home. We send you the kit, and you prick your finger, and you put it on this piece of paper, and that gives enough blood to this lab to see if you have antibodies to 96 different foods. How about that? And then you can see the ones in the blue, moderate and positive, those are foods that you have to get off of for a while. A lot of them you can add back in once we fix the leaky gut. The ones on the right are you can have in your diet. Just doing that alone just saves people so much aggravation and so much, their symptoms just go away when you start eating the foods that are causing an immune response. And then we see low vitamin D as an autoimmune trigger. Vitamin D is kind of like, we have in our immune system, they're called regulatory T lymphocytes, or Tregs, okay? T3 they're also known as too. So these are like the generals in our immune system, and these cells need a lot of vitamin D to work. And if you're autoimmune, your vitamin D doesn't work a 40-hour week. It works an 80-hour week, okay? So we like to keep both forms of vitamin D levels on someone that's autoimmune between 80 and 100. And you don't want to go too high, because around 150, it can be toxic. So we measure vitamin D, both forms. And a lot of you aren't absorbing your vitamin D because it's a fat-soluble vitamin, and you need a proper functioning gallbladder to do that. So we always use an emulsified form. Here we see a condition known as dysbiosis. This is where, in the gut we have 30 to 50 different species of bacteria that do a lot of good things for us. One of the things that they do, we have this little cool relationship. We provide a nice little home for them, and they do a lot of things for us. One of the things that these microbes do is they produce these what are called postbiotics. These are chemicals that our body needs. They eat prebiotics, which is the fiber in our diet, and then the probiotics, which are the bacteria, produce these postbiotics, and one of them is called short-chain fatty acids. And short-chain fatty acids, just like vitamin D, modulate the immune system. So many of you out there are autoimmune because you just got a really bad gut microbiome. The beauty part about the gut microbiome, once we do this test and we figure out what's going on, the gut microbiome changes every 5 to 7 days. So it doesn't take long to really repair it. See all the highs in here? These are opportunistic bacteria that are overgrowing in this person's gut. So when they eat, they over-ferment and they get gas and bloating and sometimes constipation, sometimes diarrhea. It's known as dysbiosis. You know, it's amazing, you know, when we go through these, I mean, does your doctor ever check for these? Honestly. So if you're suffering, that's why this video is a message of hope. You can learn, you can take charge and take control of your own health. Gut infections, here we see Helicobacter pylori or H. pylori, common gut infection. That's going to drive the immune system crazy too and trigger autoimmunity. And then there's certain genetic mutations. There's a process called methylation. It's a chemical process where we move carbon and some hydrogens off the molecule or onto a different part of the molecule. It's called methylation. And methylation is a very important process to keep our good genes turned on and our bad genes turned off. So when we run these different genetic testing, we can see if you have any of those, and we can circumvent the problem. And then here we see low cortisol. Cortisol modulates the immune system also. It's an immune modulatory hormone. And again, you can see the blue line is the patient, low. So this person also, I can just tell you, I mean, I don't remember the patient. When we see low cortisol levels like that, we're going to see melatonin levels, which kind of works with cortisol tandemly. They're going to have sleep problems. So we have a whole video on Hashimoto's disease. Here's the link that you can click on to watch it if you know you have it. So now hyperactive thyroid symptoms may be present in the beginning phase of Hashimoto's, because when the immune system first starts to attack the gland, then the gland is like spewing all this thyroid hormone into the system. And so you may get diagnosed as hyperthyroid, which you technically aren't because you don't have the antibodies for it, but you may feel that way. So a lot of you out there, if you know that, hey, when I had this brief period where I was like hyper, and then all of a sudden I got hypo, you probably have Hashimoto's. So we'll see things like heart palpitations, inward trembling, increased pulse rate. I've seen pulse rates in the 200s, right? And they're looking at the heart and they're doing all these different things and they don't look at the thyroid gland. Nervousness, insomnia, night sweats, and difficulty gaining weight. And which, by the way, are the symptoms in Graves' disease. But that can happen in the beginning of Hashimoto's. So I'm spending a lot of time talking about Hashimoto's, folks, because 70% of you that are watching this have it. And you may have other 22 also. I remember in school, they taught us just because a dog has ticks doesn't mean he doesn't have fleas, right? So we got to look at everything. So it's the most common cause of underactive thyroid in the U.S., severely underdiagnosed. I have just hundreds of patients that have come to me in my 32 years that just were flabbergasted when, and that's a word we use in Chicago, by the way, that I have Hashimoto. Why did my doctor know that? Because they don't run the antibodies. They don't run the tests. They just want to know what you have. They don't care why you have it, okay? Traditional medicine doesn't address these triggers. The most common is middle-aged females, 40 to 60, 8 to 1 female to male, although my first one was male. Babies born to women with untreated Hashimoto's have an increased chance of birth defects, especially in the brain, because the TPO antibodies can cross the placenta and get into the baby's system, right? So we see this a lot in clinical practice, like, you know, yeah, my aunt has a thyroid problem, and my daughter does too, and my grandmother, you know, so there's a genetic component to this too. Most people with Hashimoto's disease have other thyroid dysfunction, as I already said. So we gotta rule that out too. And Hashimoto's greatly impacts brain function. So the antibodies fluctuate, right? So you can get false negatives. So for example, let's say you go in for the blood test and they run the antibodies, or we run them, and they're normal. But you got all these different like symptoms, signs in your history. Say, let's run it on another day, right? And so they can fluctuate. The antibodies can fluctuate. And once you test positive, though, the antibodies, you always have the disease. There is no cure for an autoimmune disease. Once those genes flip on, it's like that light switch is broken. What we do is we use a dimmer switch, and we put it all the way down. So you can put it in remission once you identify and remove the underlying triggers. But if you go back to those triggers, it's going to come back. So it's a genetic thing, so there's no cure for it. TSH also, if you're out there and you're like, man, my TSH is high, now it's low, and it's high, and my doctor's going crazy, they're adjusting my medication, because you probably have this autoimmune variant. Very common. Some studies say that about 2 out of 3 people that have Hashimoto's, they also form antibodies to an area of the brain called the cerebellum, sits right back here in the base of the skull, which controls our ocular reflexes and our spinal reflexes. So you start to get, you can get vertigo, balance problems, you start to lose balance, visual spatial disorientation, tremors, and things like that. You start to become more clumsy. Many people also have, it's called molecular mimicry. So once the immune system attacks TPO or the thyroid globulin, they start to look at other tissues that kind of look similar chemically, and they start to form antibodies to that. Another one is intrinsic factor, which is a protein in our stomachs that we need to absorb B12. So when you can't absorb B12 because intrinsic factor is being attacked by your immune system, that's called pernicious anemia, because you need B12 to make blood cells, right? Celiac disease, which is not only a sensitivity to gluten, but when you eat, these people that are sensitive to gluten and the immune system will attack the gluten, but it also attacks the little microvilli, the outpouching in our small bowel. That's called celiac disease. That's very, very common. That's an autoimmune disease. That is also common in people with Hashimoto's. So other autoimmune diseases that are very common related to Hashimoto's are lupus and RA and vitiligo. Number 8, we're on number 8. So low TPO activity due to progesterone deficiency. Wow, we see this all the time. So if you think about TPO, remember folks, is the enzyme in your thyroid that makes T4 mostly and a little bit of T3. That enzyme has to work. When your progesterone goes low in females, then your thyroid function goes low, right? Because it triggers, it actually causes TPO to stop working. This is why, ladies, when those of you who are menstruating, when you ovulate, you get a little bit of body temperature goes up when you ovulate. Like when females want to get pregnant, one of the things they do is check their temperature. You get about a 1.5, 2 degree raise in temperature. The reason why is because when you ovulate, you get a surge of progesterone, and TPO goes, wow, we like that, and it starts to work more. So the temperature goes up because your thyroid is working harder, right? Your metabolism increases at ovulation. Increased progesterone at ovulation, increased TPO activity at ovulation, temperature regulation goes up. Low progesterone, and TPO stops working like it should. So we're right here still in this part of the schematic. So low progesterone, low thyroid, what can cause that? Birth control pills, right? So ladies, when you're on the pill, first of all, let me just say, the ovulation is not just for conception. Ovulation, there are over 100 chemical reactions in your body that depend upon ovulation. So one of them is to get pregnant, but there are 90 or over 100 more that it depends on proper ovulation. So when you go on birth control, you don't ovulate. And yeah, you don't get pregnant, right? But all those other chemical reactions won't work at their fullest. Adrenal fatigue will cause low progesterone. Low hypothalamus function, which is from systemic inflammation. The hormone that from the brain that tells your ovaries and adrenal glands to make progesterone is luteinizing hormone, or LH. And poor blood sugar will also lower progesterone. Females with low progesterone, not only do they have low thyroid, they tend to be more anxious, they don't sleep very well, they lose bone, they get estrogen dominant, they have a greater chance of developing cancer. For example, 1 out of 8 females is going to get breast cancer. I mean, that's amazing. When you go on the pill, not just the pill, but any type of birth control, that goes down to 1 out of 5. How about that? Because you become estrogen dominant, and estrogen's like growth hormone. Estrogen causes things to grow. So your tumors and cancer cells will grow excessively when you become estrogen dominant. And that's the state you're in when you're on birth control. Now, I always ask my patients, are you on birth control as a form of not getting pregnant, or are you on birth control to control, your cycle? And a lot of doctors just put you on it to control your cycle, where they're not looking at the underlying issues. That's where my female hormone imbalance video will go into that. So here we see high TSH, low thyroid. Those are the markers we're going to see with low progesterone levels. That's the pattern. And then we actually do a saliva test to measure the hormones. So here we see on this, she has I can't read, it's like 20 something, 21, I think, and estradiol's at 3. That ratio between progesterone and estradiol, which is the strongest estrogen in our bodies, should be like 25-1 when you're in your second half of your cycle in the luteal phase. This is really low progesterone that we saw in this patient, and we had to address that because it was affecting thyroid. So now we have low TPO, the same enzyme that needs progesterone, can be affected by nutritional deficiencies. This is number 9, vitamin A, vitamin D, selenium, zinc, and protein. So a lot of people have these deficiencies because they're not absorbing them because they got digestive issues or they have a poor diet. So we're still at the gland level. We're dealing with the gland. So here are the markers for someone, like you could see right here, this patient had low vitamin D. So the TPO needs vitamin D to work. And so as a result, T4, it's not able to produce enough T4, and that shows up low. And then the brain's going, hey, what's going on? You don't have enough T4, and it sends out more TSH, right? And then lo and behold, we run the vitamin D markers, which we do on all of our tests from LabCorp, and they have low vitamin D. So that's a pretty easy one to fix. But see, the problem is you know, what I don't believe in is just giving you all these supplements to take. This person probably has low vitamin D because they're not absorbing it. You know, so their gallbladder's not working. They may not have acid problems. We fix that so you don't have to be on all these different nutraceuticals. So here we see low zinc. Alkaline phosphatase, ALK-Phos, is an enzyme that's found in different tissues in the body. That is a zinc enzyme. It depends on zinc, so it's going to show up low. We suspect low zinc. And you need zinc for TPO to work. Low protein, we can pick that up on the blood test. Poor gallbladder function. This is an enzyme, GGTP, is an enzyme that relates to gallbladder function. And you can see that it's not working on this individual. Folks, you're not going to remember all this stuff. What I want you to remember is that, you know, your doctor's not looking for it, okay? And if you're still suffering, I guarantee you it's one of these things, or 2 or 3 or 4 of these things going on. So there's hope. Now, we're going to cover 10 through 15. You guys hanging in there? Just keep hanging in there. This is one of my favorite ones because this is so common. So remember we said that 93% of the hormone that comes out of the gland is T4, and 7% is T3. Now, I'm going to ask you out there, answer it, which one's active? Do you remember? It's T3. So there needs to be this conversion from T4 over to T3. And many of you have a conversion problem. So this is carried into the liver, the gut, kidney, and some other tissues. And there's an enzyme there that converts T4 over to T3. It's called 5'-deiodinase. What can cause that enzyme to shut down? What could slow down T4 going to T3? And by the way, your doctor hardly ever looks at T3, right? They think if T4 is okay, according to lab ranges, right, then you're okay. But that's not the case if you have a conversion problem. You've got to look at T3. So nutritional deficiencies like vitamin A, D, selenium, and zinc will slow down that conversion. Poor gut flora, because that's one of the areas, that's what the gut microbiome does. The gut flora, one of their jobs is to convert T4 over to T3. Systemic inflammation can do it. Elevated cortisol, when the our stress glands are stressed out. Serotonin and dopamine deficiency, that's the second time we've heard that, right? That will stop the conversion over. So if you guys are on antidepressants and things like that, and your dopamine levels or your serotonin dopamine can become inefficient. So now we're moving over into our little schematic here to the conversion. And again, do you see a lot of the stuff that goes wrong with thyroid function occurs away from the gland? We've already talked about 5 in the brain, and now we're talking about 5 outside in the periphery. So here we see T3 is low, T4 is normal, huh? T4 is normal. So your doctor's gonna say you're fine, but they don't check T3, both free and total. And then reverse T3, what happens in reverse T3 is an unusable, you can't use it, right? So it gets converted into a chemical form that the body can't use, and that happens when we become very inflamed. So this gets missed by most doctors. So here we see, again, we run the stool and, test, and our stool test that we do is a DNA test. It's so incredibly accurate. Here they have a parasite. They have a protozoan growing in their gut, and that is slowing down T4 to T3. How do we know? Got to run the test. These are two inflammatory markers, C-reactive protein and fibrinogen. So systemic inflammation slows down T4 to T3. Look at the blue line, that's cortisol. Look at how high this cortisol is in this person. So we've talked about cortisol. Well, I'm going to mention it later. It's actually three ways cortisol. High or low cortisol is the arch enemy to your thyroid gland. So high cortisol, decrease T4 to active T3. And then in that case, we got to look at, why is their cortisol so high? So genetic mutations, again, certain genetic mutations will slow down T4 to T3. That's why we do this test. And here we see the liver enzymes are very, very high, these three here. And so now we got to say, well, why are these liver enzymes so high, okay? But your liver, 60% of the conversion of T4 to T3 occurs in the liver. So if the liver's not working, you're going to have a T3 problem. So we're still on at this part right here in the periphery, as we say, away from the gland. Now, sometimes there's certain causes where you get too much T3. Too much T3, okay? Now follow me. This is where I lose people. When hormones are too high, what happens is the cell starts to ignore it. I have 5 children, and I always use the analogy, when they're teenagers, the more I talk to them, the less they listened. They become desensitized, parental desensitization, I call it, right? So when hormones are high, eventually the cells start to ignore it. It's like if I just keep talking, and saying the same thing over and over, you're going to tune me out. So that is called hormone resistance. And in this case, when T3 is too high, the symptoms are going to be as if it's low because the cells aren't going to let it in. It doesn't matter how high your hormones are in the blood, it's how much are getting into the cell. So if you're taking medications like Armour, Nature-Throid, things like that, or desiccated pig T3, which we use a lot in our clinic, it's a very good option when it's warranted. But if you're taking a medication, your T3 gets too high, then it's going to be, your cells are going to start to ignore it eventually. And elevated testosterone and insulin resistance. So what happens in females, if you got blood sugar problems, and when your blood sugar goes too high, you're going to convert your estrogens into testosterone, right? You're going to have too much male hormone. That's what causes what's known as polycystic ovarian syndrome. In fact, polycystic ovarian syndrome, some of you know what that is the great mimicker of underactive thyroid. The symptoms are almost the same. So PCOS happens when testosterone levels are high, and that also happens when you have blood sugar issues. It can also raise your T3. So here we see on the lab, again, we run both forms of T3, total and free, and are too high. That's okay, we'll go next. And then here we see the patient has high blood sugar markers. So, the high blood sugar, estrogen, testosterone, high testosterone causes too much T3, and then it also causes cysts on the ovaries, leading to polycystic ovarian syndrome. Number 17, elevation of the binding globulin. Remember, the binding globulin is the protein in your bloodstream, in our bloodstream, that carries T4 and T3 around. Okay, I call it the taxi cab. So when you have too much taxi cabs, you don't have enough free. The free fraction is the most important marker in your thyroid panel because that's the active free T3. Free T3, free T3, free T3 is the most important marker on any panel. That's what you want. That's like the end of the road. That's what does the job. And then it's got to get into the cell. So there's the main cause of elevated binding globulin is too much estrogen. So a lot of you that are on birth control pills or you're estrogen dominant for whatever reason, your adrenals aren't working, when you become estrogen dominant, that's going to cause too many taxi cabs and not enough free T3. If you're postmenopausal and you're taking things like Premarin, that can also do it, which is a synthetic estrogen. Actually comes from horse's urine, a mare, okay? Birth control pills, low progesterone. Progesterone is there to balance estrogen, ladies. So we want that ratio to be like 25-1. Constipation can do it because what happens in constipation is your estrogen that you're trying to get rid of. See, hormones, folks, we make them, we use them, and then they got to go. We make them, we use them, and then they got to go. Very important. And the way that we get rid of them is we urinate them out, we defecate them out, we sweat them out, and we breathe them out. So if you're constipated, what happens to estrogen has the longest half-life of any hormone, males and females. and you break the bond and it gets reabsorbed. So constipation, your estrogens are getting reabsorbed right back into the bloodstream, and that's going to cause estrogen dominance. It's going to cause elevated tachycabs, and now you don't have enough free T3. And then poor liver function also. So we're down here in this part of the schematic. So what I want you to learn is there's so many different ways thyroid function can go wrong. You're not going to remember all this, but if you're suffering, I'm telling you, if you don't see me or work with me, work with someone that does this, and you're going to get better. So now low T3 uptake. Remember, this is the marker that puts the T3 into the cell, right? It tells us the status of how well we're getting T3 into the cell. So this is what happens when we have too many taxicabs. You don't have enough free. I live near Chicago, and I use the analogy, you're going downtown, we're going to have some fun, and you got to take the taxi cab, right, to get to where you're going. But if you can't get out of that taxi cab, you're not going to be able to have any fun, right? So proteins are meant to be bound, hormones are meant to be bound to proteins, but then they got to be able to get out at some point in time. So here we see the patient is estrogen dominant. We do on the saliva test, too many binding proteins, low T3. Low free T3. All right, number 18, low thyroid binding globulin, not enough taxicabs, and now you got too much T3, right? Now remember we said when hormones are too high, at some point the cells start to ignore it, and it's as if they're too low. That's thyroid resistance. This is usually we see in males with too much estrogens. Now in females, when you have blood sugar issues, you convert your estrogen into testosterone, right? We talked about that. In males, it's the opposite. These are the men that get like man boobs. They start gaining weight. They become less motivated. They can become more emotional. Estrogen dominance. And we see this in diabetics and mostly. And then also if they're taking testosterone replacement therapy, which is becoming more and more common nowadays, and the doctor's not monitoring them properly. Okay, so we're still talking about the binding globulins here. And on the blood work, we're going to see, in this case, elevated blood sugar, which is causing the binding proteins, too much of the binding proteins and too much estrogen in males. Okay, coming to the end of the road here, okay? So these are the ones that really get missed because everything can look normal on the blood panel, but the thyroid, the hormone is not getting into the cell. So maybe T3 uptake will be low on this. So elevated cytokines, systemic inflammation. You guys are probably like, he blames everything on inflammation. I'm like, yeah, you have a chronic illness, you're inflamed. I'll bet my last nickel on that, okay? So, and the causes of systemic inflammation, we don't have enough time to talk about them. Elevated cortisol, here we go again. So cortisol. Cortisol, remember, it's a stress hormone. Comes from the adrenal glands. And it'll affect the brain, the pituitary gland. It'll lower TSH, that's one way. It stops T4 from going to the active T3. And it acts as a bodyguard outside the cell, not allowing T3 into the cell. Deficiencies of vitamin A will cause thyroid resistance, and elevated homocysteine, which is a marker a lot of doctors look at for heart disease because it damages blood vessels, but it also blocks T3 from getting into the cell. And that's usually due to a B6, B9, B12 deficiencies, usually due to malabsorption and or genetic mutations. So we're at the very end of the trail here, not getting the hormone into the cell. That's the key. It's like this. You're driving around in your car and your gas tank's empty, right? And you're like, but you got a 5-gallon gas tank or thing in your backseat of your car. Doesn't do you any good until it gets into the tank, right? So hormones are the same way. They don't do us any good unless they get into the cell. And I'm teaching you, these are things that really go on. I see it all the time in my clinic. That the hormones could be, your hormone levels could be great, but if they don't get into the cell, it doesn't matter. So there we go. We see a panel, thyroid panel, all normal, but then I look at homocysteine, I look at vitamin A, I look at systemic inflammation, and we know what's going on, thyroid resistance. So high cortisol right here, the blue is the patient, the green is where the patient should be, blocks thyroid hormone. That's a saliva test that we do. Here we see this person really inflamed. Iron markers always elevate. They're what we call acute phase reactants. They elevate when a patient's systemically inflamed. So does C-reactive protein and fibrinogen. And here's homocysteine at 17. Wow, it's really high. So homocysteine blocks thyroid hormone. So these are things that we look at. Even though the panel looks normal, the thyroid panel looks normal, we know that this is going on. And then high homocysteine due to genetic mutations, I already mentioned that converting our B vitamins B6, 9, and 12 into the active state. There's 7 genes that do that. One of them that gets the big notoriety is MTHFR. A lot of you probably know what that is. So this person, we can just totally circumvent these genetic weaknesses through proper nutraceuticals or supplements. So a recap. According to the scientific literature, there are 22 ways thyroid function can be low. Traditional medicine looks at one of them. Woefully inept. And I love giving these talks and doing these videos because it's like therapeutic for me. It's like I get it off my chest. It really bothers me that medicine is really doing a disservice when it comes to this. Proper testing is crucial. You could spend a lifetime or two trying to guess at this, folks. The most common cause of low thyroid in the United States is an autoimmune disease known as Hashimoto's, and then there's many, many causes to Hashimoto's. Almost all people with thyroid dysfunction have multiple causes, and all must be identified and removed to have success. Thyroid dysfunction affects every cell in the body, especially the brain. The critical tests that we have to do for any thyroid issue, comprehensive blood work using functional ranges, not lab ranges. We got to look at the antibodies, TPO and TGB, or the TSI one for Graves' disease if we suspect it in the history. Reverse T3 uptake, both free and total T4 and T3. Then what we do, folks, is I teach you going forward, these are the markers. If you want to work with your doctor in the future, these are the markers you want them to run, and if they're off, just email me and I'll tell you what to do. Leaky gut testing, food sensitivity testing, because there's so much autoimmunity due to those two things. Genetic testing, DNA stool testing, because the gut microbiome crucial for good thyroid function, and thyroid function crucial for good gut microbiome. And then we do salivary adrenal testing. So we look at cortisol, DHEA, progesterone, estrogens, and testosterone. So let's talk about a little bit about why this stuff impacts brain so much. You know, I'm from the south side of Chicago, which is kind of like the rough and tumble part of Chicago, the blue collar, lunch pail type. My dad was a union plumber, and he raised us, and he was also a Marine, right? So that's how I was raised. Metabolism, it simply means, and I talk like I'm from the south side. I like to use simple analogies, converting your food to energy. Food to energy, food to energy. And I know if you're watching this, you probably don't have good energy. So metabolic problems stop that. They impede you from making energy. Now, what you need to understand is the brain weighs 2% of our body weight, yet it consumes 30% of our energy demand. And so all metabolic problems are going to cause problems in the brain. Not the kind of problems you can see on an MRI. These are functional problems. So there are 5 different categories of symptoms, neurological symptoms that we see. Abnormal sensation. Well, cold hands, cold feet, right? That's a neurological sensation. Ringing in the ear. That's another really common one. Abnormal pain. Your brain is perceiving too much pain. That's what happens in fibromyalgia. Abnormal movement, like your gut doesn't move right. Constipation, diarrhea. Tremors or fasciculations, muscle cramping. Abnormal autonomics. This is the part of the brain that controls bodily functions automatically. So we'll see things like dry eyes, dry mouth, problems swallowing, sleep apnea, poor digestion, hormone imbalances, frequent urination, constipation, poor digestion, poor temperature regulation, heart palpitations, high blood pressure, low blood pressure. Those are all autonomic functions. Abnormal cognition or abnormal cognitive changes like memory loss, anxiety, depression, lack of focus, lack of motivation. You become less social. You become a different person. And abnormal posture, chronic neck pain, back pain, ocular reflexes go off. So vertigo is very, very common. So these are some of the neurological symptoms that we see go away when the person has thyroid issues. Now, what I always do, just from the history, I know what areas of the brain I took. After I got into chiropractic, I got into functional neurology and then functional medicine. And then functional neurology, what we'll do is we'll have you do certain neurological exercises at home to help develop what's called neuroplasticity, or reconnecting that area of the brain after we remove the metabolic factors. So I always look at it like the metabolic problems that you have, food to energy, that's like the factory that's polluting the river, right? And the pollution of the river is the neurological stuff. So we like to get rid of the factory, stop polluting the river, then we want to clean up the river or give you neurological exercises that you can do at home to develop neuroplasticity in the areas of the brain that are bothering you. So now we're going to watch a few testimonials of actual patients that have come to my clinic, and I hope you enjoy it. And when I come back, I'm going to I'm going to offer you an opportunity to consult with me either via Skype, phone, or if you live near the clinic, in the clinic, and at no charge. At no charge, I'm going to explain that to you, so that we can discuss and see if you're a good candidate for this.
Hello, my name is Cheryl Andrews. I am 52 years old. I found Dr. Beyer almost like being touched by an angel. I was having a procedure at the hospital for having issues with swallowing, and the nurse there just touched my arm and said, "You need to see Dr. Beyer, he will help you." That was after I was telling her all my medical issues. I had severe thyroid problems. I had gained 80 pounds, losing my hair, alopecia, which they told me it's an autoimmune disease, nothing can happen. They couldn't do anything for my hair. So I was just slowly deteriorating, and no energy, no will to even do anything. I am with him 5 months. I've lost 52 pounds. My hair, as you can see, has grown back, which has been tremendous boost to just self-esteem. I am thankful that I found Dr. Beyer because he has given me my life back.
When I first came to Dr. Beyer, the reason I came to him, I was very frustrated with my fatigue, my inability to lose weight, my constant struggle in dealing with my newly diagnosed Hashimoto's. My hairdresser actually referred me to Dr. Beyer after I complimented her on how wonderful she looked. So she extolled, this great find here in Tinley Park, close by. I felt great. I felt like I've landed in the right place, that my issues were really heard, and they were going to be resolved. The pounds came off. Most importantly, my inflammation has decreased. I no longer have any joint aches and pains. I feel like slowly I'm reclaiming my life and being able to really participate 100%. So I highly recommend it. I am astounded at how wonderful I feel. Really, it's life-changing.
And when I first started the program, I was feeling kind of awful, but I kept getting information that I was pretty healthy from all of my doctors were telling me that I was okay. And Dr. Beyer is doing a seminar, and I'm like, well, I'll go see what it's about. I came in, listened with everyone else, and immediately became excited because all the information that I was getting just in that small seminar was like everything that I had been needing to hear when I was going to my doctors. And so it turned out to be one of the best decisions that I made for my health. I'm here and I feel awesome. The vertigo is gone, the headaches are gone, no heart palpitations, haven't seen any skin rashes for months. On top of that, I've lost about 35 pounds, and I had gained about 40 pounds within a year's time, so I'm ecstatic about the result.
My name is Jessica. I'm 32. I came to see Dr. Beyer. I was having thyroid problems that weren't getting any better, even though my doctor said my lab tests were good. I came in, I was losing my hair, I had a lot of stomach issues, I was tired all the time, I didn't have any energy.
And when you came in, you found us how? You came to one of our workshops, Jessica?
I came to one of the workshops. I saw the ad in the newspaper.
Okay, and then when you went to the workshop, obviously it kind of made sense, right? To
Right.
you? Otherwise you wouldn't have come in. Were you still a little skeptical, though, whether it would work or not, be honest?
A little bit.
Okay, but it made sense, so you joined, you did our program, and now we're wrapping it up today. There's 6 months, right?
Right.
And how do you feel today compared to that first day you came to our workshop?
I feel so much better. I have so much more energy. I'm not tired all the time. I don't have the stomach problems that I used to. I've learned how to eat things that don't make me sick. I've learned the things that do make me sick and what to stay away from, so that I can.
And you've lost some weight too, right?
I have. I've lost quite a bit of weight. I've lost 35 pounds.
35 pounds. And was that kind of easy? It just kind of came off, right?
It did really came off. I didn't even realize it was really happening.
Yeah, because we improved your metabolism. So anyone out there that's suffering with a thyroid problem, would you recommend they at least investigate our program? Do you think
Absolutely.
was it worth your time and your money?
Yes.
All right, that's
Definitely.
great. And do you feel like you know how to take care of yourself now that we're wrapping up today?
Yes.
Okay, that's great. Thanks, Jessica.
Hi, my name is Teresa, and I was a very desperate person when I came in to see Dr. Beyer. I was having many issues, mostly with my thyroid. It scared me a lot. My resting heart rate was 122 beats a minute. I couldn't get up and walk across the room without it raising above that. This was lying in bed, not doing anything. I'm a breast cancer survivor. I have high blood pressure. I had high cholesterol. I had acid reflux. But like I said, the scariest thing for me was the heart rate caused by hyperthyroidism. So I go see an endocrinologist, and of course they put me on medication. And I look in see an ad in the paper, are you having thyroid problems still? So I came in to see Dr. Beyer and went to a seminar.
And you
What?
you came in with Stanley.
Oh yeah, my husband came with. Now
Okay.
he has been a big health advocate for a long time and say, Teresa, try this, Teresa, try this, do this, do this. There's something wrong here. Well, we came in, we listened to Dr. Beyer, and we liked what he said and figured, what do we have to lose? We're coming in, we're gonna try this, at least do the testing, at least do everything. Give it a shot. Well, came in October 9th, I actually started the program. October 9th, 2017. My heart rate dropped to normal. In December, I saw my general practitioner. They took me off of all my blood pressure medication, off of my cholesterol medication. My endocrinologist called and told me quit taking my thyroid medication immediately because it completely switched from one end to the other. I had a sleep study done during this time because I did have sleep apnea, and I did say did. Sleep apnea is gone. I've lost over 40 pounds, even when I wasn't trying to. We went to Disneyland with our grandkids, and I did something I never thought I could do, get in and out of rides, which I could not do before. Hang on to everything and slowly ease yourself in, ease yourself out. I was hopping and I felt like a mountain goat. It was great. And all that. It is unbelievable. People see me, they don't know what happened, how it happened, and they want to know, how did you lose the weight? I didn't try to lose weight. The weight left by itself. My heart rate is now about 70 beats a minute. I can walk, I can do different things. My blood pressure is a little on the lowish side from high and uncontrollable. My cholesterol is normal. No acid reflux. All of my body functions are functioning the way they're supposed to. And I've been singing Dr. Beyer's praises and Alexa's praises because she's been leading me with the diet, what to eat, what not to eat, what is good for you, and basically finding out all the things that are no good that we've been eating and consuming. And if it's so delicious, it's mostly chemicals. And if you can get away from all that, it's great. And I am so thankful. Both of us. Side effect on this, I eat, my husband eats what I eat. So when he's eating what I eat, he lost 25 pounds. His blood pressure medication was cut in half. He's off his cholesterol medication, and he's off his diabetes medicine. And this was just going along following with me. So God bless these two people. They've been fantastic.
Thank
Thank you,
much.
Teresa.
I felt absolutely awful. I thought, this is how I'm going to meet my demise and die in life, because I was just not that person. I was getting fatter by the minute, no energy, taking naps all the time, retired, and I thought, okay, this is retirement. I'm just going to sleep the thing away. And so I had gone to a mainstream doctor, and she gave me pills, of course, and I thought, I don't want to live my life on pills, but I took them. So then my husband read the article in the newspaper and said, well, why don't you try this guy? You know, because I'm more about natural than synthetic stuff. So then I tried you. I feel energized. The weight is dropping, but a lot of inches. These jeans I haven't had on since last year, and I put them on this morning. It was like, whoa! But my energy level, I don't nap all day. I don't have vertigo anymore. I'm just happy as a lark.
Okay, so what's next, folks? Call the number right here on the screen to schedule your 30-minute consultation. Sometimes I go over 30 minutes, okay? The calls are answered 24/7. Now, if you call and you schedule a consultation, they're going to be emailing you some really important paperwork to fill out. And I want that filled out before the actual consultation. I want to see what's going on, and we'll be able to make better use of our time. So it's comprehensive consultation to determine if you're a good fit for what we do. It's a wonderful opportunity for you to just take advantage of it, okay? $75 fee to reserve your time. Normally I charge $450 for my consultations. I don't do that. I'm offering you at $75 because I don't have to explain this whole 1-hour video to you, okay? Now, you're like, Dr. Beyer, I thought you said it was going to be no charge. Yes, if you keep the appointment date and time or do not cancel within 24 hours, I will refund the $75 to you. Okay, hopefully that's very clear to you. Because what I don't like is we schedule a half hour of my time and then, you're not there. I call, I get voicemail and all of that. So that's just my way, your way of reserving your time, and then we'll refund that to you if you keep the appointment or you cancel outside of 24 hours. We accept any credit card, okay? You'll be sent, like I said, via email, all the necessary paperwork to be filled out and sent back to me prior. The sooner the better, so I have time to look at it before your consultation time. And then if you live in the area, obviously I do face-to-face consultations can be done. But like I said, so much of this is done virtual now, so it's just information that we're sharing. So the purpose of the consultation, we're going to have an open, honest discussion of your chronic health issues. You're going to be amazed at some of the stuff that you're going to hear. And I've heard it all, 32 years, well, maybe I haven't, but rarely do I hear something that I haven't heard. So we're going to do a comprehensive history based on your paperwork and our discussion together. I want to know, what are your top five concerns? How is this affecting you the most in your life? What medications and supplements and for how long that you've taken? And what's been done? Have you had surgery? Have this or that? What has helped and what has not? That tells me a lot right away. And what are your goals? Do you want to get off meds? Do you want to lose weight? Whatever your goals are. And then what are complicating factors, which are usually stress factors, bad relationships, bad jobs, and things of that nature. We talk about that. I need to know, are you a good candidate for this program? And you need to know, how long will we need to work together? Typically, I work somewhere, usually 6 months, sometimes up to 9 months, and we consult every other week, okay? But you have unlimited email access to me. That's important because we don't want to wait 2 weeks to tweak things, okay? So that's usually how frequent the consultations are, but we have this thing called email that I think is here to stay, okay? And I'm 60, so when it first came into being, I'm like, anyhow. So we can communicate very easily that way on a day-to-day basis. Now, some people, and this is where I get into the consultation, I know that some people have certain attitudes like, well, I'm not going to change that, and I'm not going to do that no matter what you say. I'm like, okay, this program's not for you because you may have that, and it won't work, and you're not going to be happy. So I know that you have to have almost like this attitude like, I'm going to do whatever it takes. I'm sick and tired of being sick and tired. If I know it's going to work, I'll do it. And that's the beautiful part about what I do is, right now you may be thinking, well, this makes a lot of sense. Should I schedule a consultation? But how do I know if it's going to work? You can't know if it's going to work because we haven't done anything yet. What qualifies you right now to call that number and consult with me is that this makes sense and you have an attitude like, I really, really, really want to get better. So I'm tired of the madness. And now, is your spouse or significant other supportive? I'm going to tell you right away, if I got a patient with thyroid, it's usually female, and her spouse is just fighting them all the way on it, it's not going to work. You got to get him on board. And I usually talk with him or her, usually him, and they see what this is all about, or they watch this video, right? And they say, oh, okay, that makes sense. So I always admonish my patients that are watching this, have your spouse or significant other watch this too before the consultation. Now, there are certain people I can't get better, right? And after over 32 years of doing this, I'm pretty good at knowing. So I'll be totally upfront with you. If I don't think I can get you better, I'll tell you, I don't think I can get you better. I don't want you spending your money on something that I'm not sure about. And I'll give you the best direction to take. And then there's a financial consideration too that I'm going to go over here in a little bit. So after our consultation of 30 minutes or so, and if I think that you're a good fit and it sounds good to you after we talk, I schedule a second consultation immediately, okay? I just need a day. I need time to kind of assimilate and process everything that we talked about and see what testing I specifically need to do in your case, and then how long we should work together. And then we have the second consultation and I go over that. So at the second consultation, then we're going to discuss all the recommended tests and what these tests do and the length of care. Like I said, usually 6 months to 9 months, and we have a regular formal consultation, Skype, phone, or in person if you live in the area. And then I go over the exact cost of care at the second consultation. So these fees that I'm going to be giving you are approximate and may vary slightly depending on your specific plan, right? We offer care credit financing if you qualify. It's a company that finances people for healthcare. So this can be done in our office only if you are present, right? So if you live in the area, that works. Or if you're what we call a virtual patient and we're working with you virtually, our staff can guide you through the application process at home. It takes like 10 minutes. So here's what it breaks down to. So these are approximations, but I'm giving it to you. Now, Care Credit offers, 7 different options to finance. You can do interest-free for 6 months. The payment would be approximately $1,100. Interest-free 12 months, payment would be $560, half. Interest-free 18 months, $375. Or 14.9% for 24 months, $325. 15.9% for 36 months, $240. 16.9, did I say that one? No. 16.9 for 48 months, $195, and as low as $170 for 60 months. If you pay up front with cash, card, or check, we give you a $500 discount. Some people want to pay partly up front, they want to finance part. We can do any option that way. Folks, listen to me, all right? Those people who know me, I'm just a straight shooter, I'm as honest as can be. There is no obligation to begin care after this. I'm just telling you what I know. I'm sharing with you. And if you get some good information from our consultation, you know what? I feel good about that. You become a patient, we're going to roll up our sleeves and get you better, okay? But there is absolutely no obligation. I'm not going to push you into something that you don't want to do, okay? That's just not how I am. So, have your spouse or significant other watch my video or attend my webinar, which we give webinars, live webinars, specific to your condition. The other thing too, folks, this needs to make sense to you. Please do not make a consultation if you're going to call me and try to convince me that this is a bunch of malarkey, okay? Or, I don't know about this. No. This has to make sense to you for you to make a consultation, okay? And please be serious about your illness and commitment. If you're not all in, doc, if I know it's going to get me better, I'm in, okay? I'll be honest with you, patients do 80% of what I tell them. They're going to get significantly better, okay? All right. And then finally, folks, you'll be getting real answers to the true underlying causes of your poor health. What people hire me for is to figure them out, coach them through, and then at the end, you're going to have all these tools and things that you're going to know specifically about your body that you're going to be able to use the rest of your life. I am an educator. That's what I do. I am an educator. That's what doctor means, teacher. So we want to teach you for 3 reasons. Validation. I get people crying in my office or on Skype because when we go over their blood work, the initial blood work, they're like, finally, someone has me figured out. I know I'm not crazy. It's not all in my head. They figure me out, and that's the number one. That's the first reason why we want to educate you. Number two, there's going to be life changes. There's an old saying, the definition of insanity is doing the same thing over and over and expecting something different to happen. Or the other one that I like is if nothing changes, nothing changes. You just don't know what to change. That's what people hire me for, okay? But we're human. So in order to make those changes, you need to know the reason why behind the change. Once you start doing it and get better, then I got you, okay? Then you're not going to want to go back. So that's another reason why we like to educate. I mean, I give out handouts. I give out big binders. When we see something wrong in the blood work or whatever, I give you handouts to read on it because I want you learning the reasons why. And then the third reason I already mentioned, we want you to be independent, okay, of me in the future. We want you to be able to, we want to empower you to be able to take your own health into your own hands and not be so dependent on someone with a white lab jacket, okay, that really doesn't know thyroid function. So you're going to have these things. It's life-changing experience. So I'm Dr. Ed Beyer. I hope this makes sense. If that does, please call the number 24/7. Someone will answer your call. And please let them know that you watched the entire video or webinar in that case. So I hope you enjoyed it. I hope to meet you soon.